go.
Live.
We're super
We're live.
We're like so live right now. It's ridiculous.
You don't have to live with pain or chronic neuro issues any longer. In this podcast, you will learn how to stabilize your brain, body, and biochemistry for the rest of your life. I'm Dr. Teams, and this is the NeuroReset podcast.
Hey, everybody. Welcome to the next episode of the NeuroReset podcast. We have a super special guest with us today, of course, our very own Dr. Rachel. We are super excited to have her here. We've had her here just over a month. We're settling in and just getting real comfortable with everything, and we're just excited to have her here. It's really nice to have some fresh experience and a new way to look at humans and the nervous system, and we're just really excited to have her. So thanks for being here, Doc.
Yeah, I'm excited to be here. It's been really great.
So she acts like she's not all that comfortable being on camera, but we're about to find out, right? So, first off, let's just tell everybody, all our listeners and our watchers, like who you are, where you're from, what got you into chiropractic and neurology and all that stuff.
Yeah, so I'm Rachel. I'm from Portland, Oregon. I was born and raised there. I've been there my whole life. So kind of how I got into chiropractic is, so my mom works at a chiropractic clinic. She manages one. She has my whole life. So I've really just been ingrained in it my whole life. Played sports growing up, so I was just kind of always in and out of the office. Just had a really good relationship with the chiropractor. So I actually was not going for chiropractic at all when I first went to school. It was very different. I was going for criminology, super interested in all of that. So I realized that wasn't the path I wanted to go down, so I got into nutrition and then kind of wanted to do a little bit more. So I shadowed the chiropractor that I had seen my whole life, and it kind of just felt really natural. So that's kind of how I got into it. I knew the benefits of it. I lived it all the time, so just felt right. So then I applied to school, and here I am.
Super easy story.
Oh,
right?
yeah.
So, what kind of sports did you play?
I played basketball for 12 years.
Okay.
I also played water polo for a little bit, but it was just too much with basketball, yeah.
Interesting. So what level of basketball did you start playing at? Where did you end?
So I started in second grade, so just whatever you do in second grade, yeah. And then I played up until my senior year of high school. And then I decided it was, for me, I just decided not to play anymore. I just didn't have the passion that you need if you want to go and play college. I just didn't really have it. Kind of wanted to focus on school, so that's where my career ended for basketball.
Gotcha.
Yeah.
Do you still shoot hoops?
I do, yes. I did a lot in school, in chiropractic school. We had a full gym there,
Yeah.
so I played basketball there pretty often.
Did you wipe the floor with everybody
Every
there?
time.
Oh, that's good stuff. All right, so you've shadowed, right? You're around chiropractic for a long time.
I did actually work for a clinic for 3 years.
Oh, okay.
While I was in school,
Right
and
on.
a little bit before, yeah.
What kind of techniques and things did they do that either resonated or didn't resonate, and how did you kind of end up doing what you want to do now?
So neither of them were neurology. So they were pretty much just your regular chiropractic office. The one that I grew up seeing, he kind of did a lot, So I broken many bones, and so he was actually usually the first person we went in to see, just to make sure if it was actually broken or not.
I assume they had like an X-ray unit.
He had an
or
X-ray
something,
unit. Yep, he had an X-ray unit. So X-rays were done there. And then, so a lot of just kind of adjustments mostly. And then the second one I worked at was very similar. So it did resonate with me, I saw people coming in a lot of pain, people getting the benefits and leaving and feeling better over time. But actually how I even got introduced to neurology was through the guy that I worked for 3 years. He was really interested in all of that, so he would talk to me about it. Mm-hmm. He just never went down that path. And so he brought that up to me one day and was like, if I could do it all over again, this is what I would do.
That's cool.
Yeah.
That's kind of the question I was curious.
Yeah.
I was real curious about. And, the neurology path is kind of an all or nothing, right? It's hard to dabble. It's very difficult to dabble. even if you put all of your time into it, it takes a couple of years to really get through it all, right?
Yeah.
And, I always, and I believe you got into it while you were in school, correct?
Mm-hmm. Yeah.
And so to me, that's the best time to do it, because you're like, well, what else am I going to do?
Yeah.
Right. But you know all too well that the moment you start working, and if you're not in that type of position, it's really difficult to continue to do it.
It is really difficult.
Because most of the time when we come out of school, we work for someone. And like my experience was with a great guy. He's probably even going to listen to this. I had the opportunity to work with someone. Basically, it was a kind of a pain management office. So we did adjustments. There was a nurse practitioner, did some injections and things. We brought in decompression early on. We didn't have like a whole plan around it. But ultimately, we just try to kind of help people and do that whole thing. He would ask me, hey, you want to do like a quick neuro workup on somebody? And I was like, okay, sure. That person, I did some pursuit testing, and they literally just fell over on the table. Like they were seated and they fell over.
Oh,
I was like, oh boy. So I can't just do a quick workup on this person, right?
Yeah, no.
But when you don't use it, you lose it in a way, or at least you don't further or keep it real fresh. And so, the neurology program is no joke.
No, it's not.
No joke. It's way more complex now in terms of the availability. Like we just had the 800 series back when I was taking it. And now it's like 800 series, headache program, FNOR program, dizziness program, TBI program. They have their functional medicine program, their like neurodegenerative program. They have their OPK program.
Yeah.
Like,
Masters
we're talking
now,
8, 9, 10 programs compared to the 1 or 2, which were the kind of the foundational work. So with further education, I'm always curious. That's why I'm like bringing the fresh blood. It's like you are going to be learning stuff at a different level than I ever learned, which is really cool. And then the guys that I used to work with learn stuff at an even different level than I learned it. So it's like really cool to see this like generational activity come up through the neuro world. So I'm really excited to get you up to speed on the board certification. That's going to be real cool.
Yeah.
So he says, if I were to do it again, I would go get the neuro program.
Yes.
How long did it take for you to kind of turn down that route?
So that was...
And this is before Kairos school,
This
right?
was before, when he mentioned that to me. So I didn't really know what he was talking about in the moment. I didn't really understand all of that. So it was probably my second year when I really got into it. One of my friends joined the program. And so he was talking to me about it. And that's kind of where it all clicked to me, where I was like, oh, this is what the chiropractor was talking to me about. And then he kind of showed me a little bit of what the program was, what he was learning about at the time, because he was already kind of a year into it. So that's basically just kind of how it happened, is someone introduced me to the program. I looked into it, and I was like, yeah, this is really cool.
Awesome.
Yeah. So that's kind of how the program started, and then eventually starting. So
you told me, obviously we've talked a lot outside of the podcast here, but you talked about working with some of these dysautonomia and POTS cases and whatnot. Tell everybody where you worked with these and kind of the exposure and the interest and all that. Where'd that come from?
Yeah. So kind of how everything else was, I really didn't know what you could do with the neurology program. It was kind of really severe cases at that time, where that's where I was like, I don't know. I didn't really know enough about it at the time. So I kind of just wanted to get into the program and see how it is. At my school in Portland, I had this opportunity to do excuse me.
That's okay. I'll talk for a minute if you need me to.
Yeah, no, it's okay now. So
we both just ate lunch, and we're trying to do this podcast before our patients show up. So we're both
yeah, exactly.
talk about food sensitivities and things, right? Okay. You good?
So I'm good now. Yeah.
Right, take
so
two.
There was this program for something called CBI at my school, which was, I guess I'm not okay. I need to grab my water.
We'll grab some water. We'll be right back.
Okay.
We'll just roll. I'll just get you a bottle here.
Okay, thanks.
Coming at you.
Thanks.
So whoever's editing this can go ahead and just cut this last minute out or so.
Hopefully. Okay. good now, hopefully.
Ready? 3, 2, 1, go.
Okay, so at my school, there was this program called it was like a clinical-based internship.
Mm-hmm.
So it was ingrained at my school, but it was a different part of regular student clinic. So you don't get to do it until you're in clinic and get to see patients.
Yeah.
So there was one with the Dr. Bill Moreau, who, if people aren't familiar with him, he used to be the
Is he Olympic?
directors of the Olympic. Yeah.
Okay.
So he was, the chief medical officer of the Olympics. And he came to my school to start this kind of more specific program just to help students get a really clear and better education in a sense, just to once you get into the clinical side of things. So when I started, he started working with patients with POTS, post-concussion syndrome, dysautonomia, and all of that. So I was able to work under him my last year of school, which is where I learned about pretty much all of these things. I didn't know what POTS was before I started. I didn't know what dysautonomia was. And so once I got into that, I realized, one, I really loved working with this patient population, and just how much you can help people, which was really awesome. So, and it was just really interesting to me how much there wasn't known about it, even just, a couple years ago.
Yeah. And that was a few years ago, right?
It was a couple years ago.
A couple of years ago. We've learned a lot about this condition, and it's become very popular in kind of mainstream media, so to speak.
Yeah.
But, again, we talk about dysautonomia a lot. POTS is basically a diagnosable version of dysautonomia. And it's basically where your fight or flight system and your rest and digest system don't work well enough together to get the proper amount of blood flow to the areas under demand at that time. So for an example, somebody could have like an anxiety attack, and we get that fight or flight threshold cranks up, and we don't get blood flow to our arms or our feet, and we get like numbness in our arms and our legs, or our face, or we get a migraine, or our vision gets weird, or our cognition goes, or we get dizzy, or brain foggy, or we can't control it, and it turns into a full-blown panic attack, like you can't even breathe appropriately, right? So all that is your survival mode just turning on, and instead of running from a bear, you're stuck in place, so you get no dilation of your vessels, and everything kind of goes numb, right? And so, now that you've been in that, you worked in that type of clinic, now you're in call it an outside clinic.
Yeah.
I mean, how much of that stuff do we see?
All of it, all the time.
Yeah. And, it really is, it's super rewarding when people get over that hump.
Yeah.
Because just this week alone, we've probably talked to 3 or 4 people who have gone to Mayo and every other neurologist or multiple other neurologists, and they all have the exact same treatment parameters for them. It's almost always a beta blocker. It's almost always compression stockings, and it's almost always intake more salt. And while that might help the symptoms a little bit, clearly we know that when we look at people's eyes and we look at their balance and their coordination, we ask them psychological based questions like, what are your stresses, what are your triggers, and you watch them almost have like a panic attack in front of you just talking about them. We know that beta blockers, compression stockings, and like salt aren't going to take care of the problem.
Right.
And I think our understanding of the nervous system, how it interacts, is what makes people fly in from New York, from Montana, from Oregon, from Seattle, from whoever else is on the list to fly in. It's really rewarding knowing that these people are making like a super good decision by flying in. They're going to spend their resources, spend time here. You and I both take a look at these cases, and we tag team these cases, and the next thing you know, they're like significantly more stable when they leave. So that's a lot of fun.
Yeah, it's amazing.
Do you have any cases that you worked on at school or that you worked in this the CBI clinic? That you were like, holy mackerel. Like any of those like kind of game-changing things for you that you ran into, or that you just felt like over and over and over, you're like, this is absolutely why. Like, why did you what did you like about working with
Yeah.
like the POTS dysautonomia types of cases?
So there's one case that sticks out to me, like in particular when you ask that. So there was one where this patient who, they were post-concussive, so they had dysautonomia from a concussion that had happened 4 years prior. They were on disability. They, like, their whole life turned upside down. Like, their relationships weren't doing good. I mean, this person had tried everything and nothing was working for them. And it was to the point where he couldn't read anymore. Lights had to be out when he had to do his intake, lights off, and someone else had to read the intake for them to fill it out. So pretty severe, couldn't function, and had kids, couldn't hang out with their
father,
kids. Yeah.
was it a man?
It was a guy, yeah. Couldn't be a father.
Couldn't
Be a
brothers.
husband, couldn't,
Wow.
yeah, all these things. And this was my first time really being kind of more in control of a case that's pretty severe. So I worked with him for 3 months, and just in that 3-month period for what we were doing, he went from not being able to read to he filled out the intake on his own, lights on, perfectly fine. He was hanging out with his neighbors again. I can't remember exactly so his intake was pretty severe when he filled it out, and then 3 months later, it was like 80% decrease of everything, which is huge for somebody like that,
Yeah.
And I ended up leaving because it was at the end of my internship, and probably 2 months into me being gone, so a total of 5 months, he had told everybody at the school that he actually wants to go to chiropractic school now.
Oh, that's cool.
To do all that because he was basically 100% better, and now wanted to help other people the same way he was helped. So I mean, something like that, like completely life-changing things, is what really I was like, wow, that's amazing that you can help someone get to that point. If I mean, of course, a part of it, there's a lot of things that play into that. It wasn't just us, he had other people, but we kind of helped him get to that point. So
for sure. So what kinds of things, if you can remember, like a case like this, I bet you probably can.
That would be,
what kinds of things did you do in the beginning where you were like, oh, you should be able to handle this, and they couldn't, or you were surprised that they could? What kinds of therapies and things did you guys do with that?
So kind of just like, what did I see that I was like, why can't they do that? Or
like if you give them an exercise and they couldn't handle it, something as simple as
a recumbent bike.
Yeah.
They couldn't do that. So we, at that clinic, it was mostly exercise.
Okay.
Yeah, just exercise based. So they couldn't do a recumbent bike or a regular bike. A bicep curl with like 3-pound weights was too much for people. Kind of, I mean, getting up from the floor, standing up, I mean, even what we see now.
Yeah.
Things like that you kind of take for granted when you feel fine,
Right.
I mean, just being able to sit up was something that we saw a lot.
Yeah. And the thing that, one of the interesting things from, I think, our point of view, I have personally not been in a position where my nervous system has failed me like that. And so I don't know what it feels like, but I can also feel what these people feel when they come in.
Yes.
You can see the loss of hope in their eyes. You can, if their significant other or their parents are on the other end of the phone, or they're sitting in the room with them, they're breaking down and crying, and the patient's just sitting there half the time like a bump on a log, like, yeah, this is normal.
Yeah.
This is my new normal. And then, for me, I'm very thankful that I took the plunge and just, tortured myself going through the neuro program so that people who basically say there's nothing left for me, I'm like, you've never come to our office. And this is oftentimes, just like it probably was that guy's, like, end of the road.
It was, yeah.
And, if we can't help them, we are pretty confident that not a lot of people, they might not find help.
Yeah.
And so, from that point of view, where I don't know what it feels like to feel like that, but I see it, we've seen it so much that we do understand. it's really cool. It's just super, super cool to be able to give back and give these people some hope again.
Yeah.
And so, but yeah, you talked about cases that you remember from school.
Yeah.
I've got one, and a lot of those cases from school, because it is a school, the price point is so low.
Yeah.
And so you tend to get people kind of like that are disabled.
Mm-hmm.
And I had this one lady, her name was, we'll call her Brenda. She gets passed to me as the other intern leaves, and they're just like kind of keeping people together, like on the neuro side of things.
Yeah.
I mean, chiropractic is great, but if it doesn't work, but you keep doing it, you kind of hit your head up against a wall.
Yeah.
So she gets to me, same kind of thing. Every intake we had to do had to be in a dark room. We couldn't touch her arm. She had CRPS, chronic regional pain syndrome. Basically, it's a neurological condition where your brain doesn't recognize like a body limb. Say like an arm is very common, but like feet are very common also, and it's usually one side. So your brain develops this issue where it doesn't recognize the foot or the arm, and it also starts compromising the blood flow to that area. So the nerves really become very sensitized, and then the limbic system or the emotional system becomes sensitized to the pain and the fear of that whole foot situation. So it's like this compound effect of basically, don't touch my leg, I can't use my leg, I don't know how to use my leg, just forget about it. And so the brain then forgets about it. Well, when somebody tries to go do something for it, most of the practitioners on the planet are going to start working with the leg or the arm or that limb. But what we were able to do, because this was my first experience, sweetest lady on the planet just basically walked in holding her arm and is like, don't effing touch it, right? And so we work through and we start looking at some eye movements. We start looking at other body part movements and things like that, and retraining her brain's perception of where she is in space and where her body is in relation to her. And so it got to the point where she was able to actually use her arm. Still wasn't like totally asymptomatic, but she was probably at that 80% function area. But she would dip down to 50s every once in a while. There was some psychological stuff that goes along with every one of these CRPS cases, which is, in my thought process, it's like a dysautonomia for like a limb, right? As opposed to the whole body. So what I knew at the time was, I got to help this lady, I got to figure it out. Like every time I'd hear a trigger, her symptoms would get worse, like a stressful something or other, right? So I'm like, I wonder if we can reword or rewire her response to this trigger and create a better outcome or less of a flare. And sure enough, we were able to do that. So that's one of the reasons why we talk a little bit more psychological tricks and tips and things, and maybe mindset changes and words that we should use, positive words versus negative words in this office, so that we can kind of break people's bad habits that developed the problem in the first place. And so that was a fun one from school.
Yeah.
That was a really fun one. She actually still messages me till this day.
Really?
Yeah, she'll
Wow,
say
that's
happy
awesome.
birthday and things like that. So that
Wow.
was more than 10 years ago. So she was a super cool lady. So, all right, you've been here, technically you shadowed for a couple of months before we started, but what are some of the things that you've seen now that you've been here every day? And like, what kinds of changes, I guess, have you seen compared to the other exposure you had?
Changes
Or
in-
differences, I guess.
Yeah. So most of the differences is being out of school, you typically see a younger population because a lot of them were students. So just from what I've seen, just kind of age difference, and then mostly post-concussive stuff was what we were mostly dealing with, just because we noticed the physical aspect of it. People who had post-concussive just responded better versus people who have dysautonomia from something viral. They just didn't respond as well as they do here. So people who have dysautonomia or POTS, from whatever reason they have it, I've noticed respond better here, especially if it's from COVID or something more immune system versus a concussion. So that's the biggest difference that I've seen, is that those people are getting better results than when I was in school. And then the post-concussive, we're getting better results where I was at before. Yeah.
Gotcha.
That made sense.
Yeah, absolutely. Okay. One of the cool things is hearing that doc being from the Olympic world, everything they do is exercise-based,
exactly,
right?
Yeah.
And so it makes sense to, hey, let's apply this to this community or this patient population.
Yeah.
And the difficulty with dysautonomia or POTS is people's tolerance is usually trash.
Yes.
Right? Where you might be able to run 5 miles when you're in shape, no problem. You know, you have an injury, an infection, or like an emotional trauma or something that totally dysregulates your immune or your nervous system. Then all of a sudden, for you to get up and walk to the car, just getting up off the couch causes dizziness, headache, brain fog, and like anxious symptoms, right? Lightheadedness. You know, we have to get up all the time, and when it's so symptomatic, it's like people don't want to do anything, or they can't. They can't even work sometimes because they can't get blood flow to the front part of their brain to do their job. And, you know, it's I guess one of the things that we used to do is we work through just the neurology, right? Which did really well. I think now that we have kind of our protocol, we've seen so many people and we've seen how they respond to stuff. There's like a very specific point, like an inflection point where they're like, I'm starting to really feel pretty good, but they're still so deconditioned and out of shape that they're afraid to do anything on their own. So that's where we become like the personal trainer again, and we start pushing them through their physical exercise, not only muscles like bicep curls and things like that, core work, but also cardiovascular work. And when we look at, I believe it's the the new basically DPT, the Personal or Physical Therapy Association, created a new return to play for like concussion dysautonomia stuff. But that came out just in the last few months, and we've been doing the work that they're recommending for years now.
Yeah.
And it's like a graduated exercise program. We use more vagal nerve tactics and breathing tactics combined within, and we watch people's tolerance like skyrocket through where they've been before.
Yeah.
So that's one of the cool things I like about exercise, because I was a personal trainer before I went to school, and it just makes so much sense to me, especially like adjust the body, exercise the body. Makes total sense, right? You make sure it moves properly and then you move it. Right? We're movement like beings, mammals, and if we sit still, we start to kind of fall apart.
Exactly, yeah.
And so that's what got me into it, was being a personal trainer. I was like, oh, I got to adjust people and personal train them. Great, makes perfect sense. Just charge a little more, right? And it just, for me, it just kept moving and moving and moving based on the roommates that I had that were actually they were best men in my wedding. And all of us ended up going through the neuro program. And then we took all the skills, or I took my skills from the personal training, from the chiropractic, from the neurology, and basically just morphed it into one massive program that now we're basically carrying out here. And I'm just really excited to be able to like share what we've kind of built over the last 10 years and to start to replicate that, because if you can do that and other people we bring on can do that, then we can start getting this like to the masses down the road.
Yeah, which would be amazing.
It's like, I'm just super grateful that basically my roommates were going through the neuro program, and one of them and I drove down to Santa Cruz from the Bay Area to go get this like 3 or 4 year old CD compact disc. It was like a shopping bag full of seminars. Each seminar was 10 to 12 CDs, and I just pop them in my car and listen to them every day.
That's pretty cool.
Yeah, so my first one was with Klotzik on the autonomic system, which is kind of bizarre because like I just got the chills. I didn't think of it this way, but it's my very first seminar I ever listened to before I even went to one was on the autonomic system. And which is what the bizarre part about that is, that's like literally all we care about now.
It's full circle.
Right? And it's like, I literally just recognized that. Like I got the chills when I said that. I was like, holy cow, I didn't realize that we're doing that now. And that was my very first exposure to it.
That's amazing, yeah.
So, wow, yeah, I'm like dumbfounded right now. I didn't even realize that. But yeah, it's, so I just wanted to make sure that everybody out there got a chance to meet you. And if you guys have any questions, You know anybody dealing with dysautonomia, any POTS cases, any migrainous stuff, dizziness, spine pain. I mean, we can talk about spine stuff. That's like what we're bread and butter.
Yeah.
Disc issues. Like we just had a case walk in today. The guy was basically like bending over in pain. And usually that kind of stuff is disc related until proven otherwise. But we worked on him. 10 minutes later, he walks out like, oh man, I'm like 80% better. This is great.
Yeah.
So more than likely it's not a disc. But at the same time, we're running an MRI to make sure because it's been happening more and more. And that's the easy stuff for us. But there's still a nervous system attached to that.
Yeah.
Right? So even though you have spine stuff going on, we still evaluate the nervous system and make sure that that's dialed in and optimized. So pretty much everything here, we try to get some form of neuro rehab done so that we can optimize that patient. Anywho, if you guys have any of that stuff going on, make sure you give us a call, ask for Dr. Rachel, ask for myself, we'll get you on the schedule. And we just really appreciate you guys listening to this stuff because we know that you know people who need the help and we would just love to help. So with that being said, Doc, thanks so much.
Thanks
You're
for
a
having
total
me.
natural on the podcast. I'm sure we'll have you back, right? And we'll do like moving forward, guys, we're going to be doing like case reviews. So you'll be able to see the full like video case review on YouTube, but you can listen to it on Spotify, on Apple Podcast, wherever else it pops up. I think those are the main three. And then we'll be taking tidbits and stuff and throwing them up online on social and whatnot. So follow us, make sure you follow us on Instagram, Facebook. I think we're even doing LinkedIn stuff at this point now. TikTok. Oh yeah, we're like going viral on one of these last things. I think it was the Dr. Tade episode that we did, but that's getting like a whole bunch of views right now. So that's cool. So yeah, we appreciate you guys following along and learning some new stuff. And if you have any questions, just slap it on social or give us a call and we'd love to help you out. So now you got two of us for the price of one. And I guess we'll see you next time. Cool?
All right. Sounds good.
All right. Thanks a lot, guys.
Take care.
Appreciate you tuning in to the NeuroReset podcast of Dr. Teams, and we'll catch you later.